So this is going to be this is the protocol for analyzing a shoulder. The basic thing here is I'm not telling you how to adjust a shoulder because you have to check it each time. If you are just doing it rotely, you're not doing what needs to be done for the patient. So here's how I look at and analyze shoulder. For me, there's four big pieces, and then of course if they have a labral tear or if they have a rotator cuff tear or they have one, that's not what this is about. This is for people that have functional shoulder issues, and if you do this, if you do what this protocol would require you to do and they're not getting better, they have a medical condition. They have an underlying, they have tendonitis, they have a labral tear, they have a rotator cuff tear, they have underlying arthritic changes in the shoulder, they have an impingement syndrome, they have bone spurs, they have whatever. You know, they have some or all of those things. So first thing, this is Emily, she's our great model here. You're gonna lie on your back. First thing I do is I test just the general mobility of the shoulder. So I go here, I go external rotation, I go internal rotation. Now, if I see anything, so this is criteria number one. If I see anything suspicious, like what you'll notice with her, great model, she has great internal rotation here, she has great external rotation here. Here, whereas great external, internal, not there. Can you feel it? Mm-hmm. Yeah. So she has restricted internal rotation. So it's number one, I get suspicious about that. It's a super simple thing. So now I go, oh, something's wrong. Don't know what. My next step is muscle testing. And if she didn't have that, I'd go muscle test her. You had talked about, oh, she had a weak deltoid. Okay, yeah, but we've got to see what other muscles we've got. I'm going to tell you what the muscles are. Here's where we go. This is pec major, clavicular. Push in here, hold tight. Pec major sternal. Interesting. Pec major clavicular, relax please, is going this way. Hold tight. She's strong on that. Pec major sternal, which runs this way, hold tight. Weak as can be. Interesting. Lat, pulling out, thumb toward the body, hold tight. Weak as can be. Supra, thumb toward the ceiling, I'm pushing in, completely blown. Deltoid, hold nice and tight, blown. Then here, infraspinatus, make sure you keep the arm just here, relaxing. You're just rotating around an axis along the humerus. I'm going to pull here, hold tight. She's strong there. And subscapularis, I'm going to pull here. She's strong there. And I'm going to push this way, hold tight please. And her teres minor, hold tight, is weak. So what did we have? We had weak pec sternal, we had weak lat, supra, delt, teres. That was it. Mm-hmm. You see that many weaknesses, you're dealing with a subluxated shoulder. Like if you had one, maybe it's just maybe she strained her deltoid or whatever, right? But that's, when you see this many weaknesses, you're dealing with a glenohumeral subluxation. So now you can palpate it, slide down here a little bit. What I'm gonna do, I'm gonna take the thing and I'm gonna move it A to P. I'm gonna feel how the humeral head moves in the socket. So I'll take it here, come around here, Kelly, so you can see. I come right in here like this. Her elbow is in my armpit and pec. I'm going to come under here and I'm going to stabilize underneath. I'm going to push here and I'm going to just feel for springiness. She's a little blocked here. So I'm going to be doing an A to P adjustment here. So let's just take the position and set it like that. Good. Now I'm going to come here and I'm going to check. We call this medial to lateral. It's not really strictly speaking that. Relax here. I'm going to pull here. I'm like scooping it. You see? I'm going here, feeling it. So a little tight there, relaxing. Go right there. Basic principle with motion palpation, test plus impulse. If you do a test where you're feeling for the motion of it and you don't feel the motion, then put it in that position, impulse it. Okay? Next one here, and by the way, we can go here, it's already big time change. Next one we're gonna do is I'm just feeling for the motion of the ball in the socket. Really what you're feeling for is things in the capsule. I feel one right here. I'm gonna take her, put in this position, just like that. Whatever direction, vector you feel, you adjust it. Now, come here, fabulous, right? That's completely restored. Mm-hmm. Now we can go back, we can test. I'm gonna push here, hold tight. That's back. Pull in here. That's back. Push in here. Fine. Fine. Push in here, hold tight. Fine. Good. So I said there were 4 criteria. So far we're 2 down. We had the gross ranges. Then we had kind of the overall muscle testing thing. So we've got 2 in the bag. Now we're going to check collarbone or clavicle. Subclavius muscle. Subclavius is right in here. This test is arguable whether it's actually subclavius or not, but this is a really good test when people have clavicle issues. All I'm going to do, arm is here, thumb is toward the ceiling. I'm stabilizing here, don't stabilize here, obviously. So I'm going to pull here, hold nice and tight. So she's weak. We picked a really good model here, hold tight. So she's weak here. So when we see that, we can be pretty well assured that she has some type of clavicular issue. So if you have an SC problem, it's usually SC. If you have a sternoclavicular issue, you're going to have weak subclavius. So now I'll go back. I'm going to pull here because I know I have a clavicle issue. I'm going to go back. Hold tight, please. Deltoid is strong. I've got a strong indicator muscle. Now I could use any muscle that's just convenient. I'm going to push from lateral to medial here. She is strong. I'm going to push here. Hold. From medial to lateral, she is weak. Okay, so when in an extremity joint, if I'm pushing it this way, it's pushing it more into lesion, if you will. So I have to go opposite. I have to go this way. Can you see that, right? So this is a hold challenge. It's different than a rebound challenge. Just have to think with the logic of it, right? So if I push it this way, it makes it worse. What do I need to do? I need to push it this way to make it better. So the way I'm going to do that is I'm going to bring her hand across here. I'm going to set the drop. I'm going to come across this way. I'm pushing in from lateral to medial. I'll push here and set it like that. And just for good measure, and these can be a little spicy, right? Now I'm going to come back here to my test, hold nice and tight. Oh, and it's just solid, right? Mm-hmm. Now, the last thing to test, and I'm telling you, this is going to resolve probably 80% of shoulder issues. Like if you do all these things, it's going to resolve 80+%. Now, can they have muscle things? Might we need to work here? Might we need to, go into the subscap or infra or work muscles like that? Sure. Might we need to rehab it and get the shoulder stronger? Of course. Now we're going to check your bicep tendon. Remember that one? Mm-hmm. Have the person hold their arm like this. I'm going to push this way. Hold tight. You are like the perfect model. How did I know that? Okay, so what she's doing, she holds the hand out like this, palm toward the ceiling, if you will. And I'm going to push here, weak as can be. Now, this is a test for the long head of the bicep. Obviously, bicep has short head, which is somewhere in here. Long head comes right in here. Now, we didn't talk about it. Does your shoulder bother you?
Oh, every once in a while.
Okay.
Yeah.
But you lift and do stuff, right? So obviously we have the greater and lesser tubercle here. We have an intertubercular groove. Mm-hmm. We have a transverse ligament here. I think that's what it's called, if I remember. We have a transverse ligament. Some people will say, well, you have a displaced bicep tendon, long head. I don't know if that's actually physically what's happening. I just know that this tends to work pretty well. So what we're going to do is we're going to have her sit up. You can just sit straddling the table. So we know, but face that way. We know that you have something wrong with this, because if I take by comparison, you might have both. No, she's fine here. And here, just absolutely nothing. Like she's really trying. So here's the maneuver. What you're going to be doing is the person's going to have their arm here in a position like this. This is the starting position. They're going to come in with the elbow. They're going to come here and they're going to rotate in and press into their belly hard. I'm going to show you, I'm going to have a hold of her here. Really, the way to think about it is not trying to get a hold of the bicep tendon, but just hold on to the meat, if you will, right? So show me the motion that you're going to make. Good, now rotate it in like that. So let's go here, more elbow here, and now here, press like this.
Okay.
Now the person who taught me this, he said, you do this 10, 20 times. It's pretty intense. Do 3, 4, 5 times. Sometimes when you're doing this, you'll hear it click, or sometimes you'll hear it click every time they do it. Don't worry about it. What we want at the end is we want this thing to be strong. Now I'm going to get a hold. See here, I'm going to take 2 fingers. Come back here just a little bit. I'm going to take a couple fingers. I'm going to get into the meat of it. See, I'm not searching around. Where is the bicep? I just get here, and I get a hold of it. Good, now make the motion slowly. Go ahead. I'll rotate in, press in. Good. Now, here's what we're going to do. Because, especially with her, she was so nice and she put on deodorant. It's slippery, okay? So sometimes you might need to do this. And you do this with feet too, by the way. So just get in here. Hang on a second. Okay, go ahead. Okay, bring it in. Okay, pull in now. There we go. It hurts a little bit, doesn't it?
Yep.
Should hurt. Okay, bring it up. We got a couple more. Go ahead. Good, and I'm just stabilizing with my backhand here. Okay?
Yep.
I think we're gonna do 2 more.
Okay.
Okay, good, go ahead. And they'll be, yeah. Okay, one more. They'll be sore here afterwards. They may be bruised, okay? But I'm telling you, the change, go ahead, last one. The change is dramatic. Okay, now we did not get a click on that. See? We did not get a click on that. But now we go to the next part. So she's going to put her hand on her hip. I'm going to block here. I'm either going to block here and push here. She's going to be pushing back with her elbow, so she's going to push back this way. I'm going to go here, but but not yet. It's isometric, okay? Or I can come here like this, whatever works out for you. I tend to go here, so push hard. Go. There it goes. You heard the click. Maybe you guys heard it because I'm making a lot of noise. Now we'll come here, hold tight. Ooh. And that's it. Now what you can do, if you have like I know you have that device in your office, the little thumper type thing, you could do stim on this, you could do laser on this, you could do a rapid release on this, you could ice it. Like for her, going and icing this a little bit would be really good. Okay, and that's pretty much it. So the thing that you want to do, every time the person comes in, check all of these things. Some pieces you might not need to do. Now, if I check you like 2 days from now, I might need to do half of that. Maybe the bicep isn't there. Maybe maybe whereas we had 5 weak muscles or whatever it was, maybe you're going to have 2. Maybe we'll see that. Fine. I mean, whatever it is. And then each time you'll get better and better, and then we won't have to do anything at all. Okay? So that's it. I hope that helps.